Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today I will be speaking about the aspirin, but before we continue, make sure to hit the subscribe button down below for more and more videos. Aspirin is also known as acetyl salicylic acid. The group is salicylates. Aspirin is similar to ibuprofen in that both are nonsteroidal anti-inflammatory medications that are used to reduce pain if you are having headache. In addition to that, fever and or inflammation because it is anti-inflammatory, so it's useful in case if you have inflammation, and is an antithrombotic, which means that it is antiplatelet medication that will help to prevent blood clot formation. Taking aspirin helps prevent blood clot from forming in your arteries because it is an antiplatelet medication. And because of that, it may help lower your risk for stroke or heart attack. Daily low dose of aspirin makes your blood less sticky and it helps to prevent heart attacks and stroke eventually. But do not take aspirin unless your physician instructs you to do so, because every drug has a side effect. So you need to ask your physician before taking aspirin because there are contraindications. So here are the contraindications. For asthmatic patients, we do not give aspirin because of wheezing. In addition to that, the lung disease patients contraindicated to give aspirin. Not only these two, there are many. Like for instance, if you have kidney problem, if you have liver problem, we do not give an aspirin. That's why you need to ask or you consult your physician before taking an aspirin in order to know in which category you are. Are you within the indications or contraindications? Now, if you are taking it, how much you should take and when to take it. Take a low dose of aspirin once a day. Do not take it, very important, do not take it on an empty stomach, similar to ibuprofen. Why is that? Because the aspirin and the ibuprofen both are metabolized in the liver. And if you take it in an empty stomach, this will result in stomach upset or gastric upset, which means that you will start vomiting. In addition to that, it's best to take it with or just after food, but very important, not on an empty stomach. Here, as you can see, the metabolism of aspirin similar to ibuprofen. It is metabolized in the liver. That's why if you have liver problem, don't take aspirin. And not only that, it should be never should be taken on an empty stomach because it will result in gastric upset. Now, the common side effect that is experienced by many patients from the first usage of the aspirin is drowsiness or mild headache you may experience. Now, if you are taking aspirin, do not take it with warfarin. Why? You should never combine aspirin and warfarin because it can lead to bleeding problems. You will have a bleeding at the end, and that is not a good thing. So never combine aspirin and warfarin, either warfarin or either aspirin. So very important, consult your physician to know if you can take aspirin or no. Now you might ask me, what is the difference between aspirin and warfarin and why we can never combine them together? The reason is that aspirin is an antiplatelet medication, so it will affect the blood platelets, while on the other hand, warfarin is an anticoagulant that will inhibit the circulating clotting proteins in the blood, so it will inhibit the action of aspirin. That's why you should never combine them together.